So Community Healthcare Clinic was founded in 1993 to address the problem of patients with chronic illness using the emergency room to treat those diseases, but never really getting any better because there was nowhere to send them. There wasn't a clinic for patients to go that didn't have insurance. When the clinic was established, that was the goal, was to give those patients a place to go to properly manage their chronic disease.
Probably our number one disease that we manage here for our patients is diabetes. Probably 20% are diabetic. And then the next biggest one would be hypertension. So we take care of providing those medications, but many of our patients came to the United States with, 5th, 6th, 7th grade education. We have patients who do not read or write. We take that into consideration. We have a pillbox program. We do a 28-day supply of pill boxes for our patients who are on multiple medications and, they don't know what they're for necessarily or how often to take if we just put that on a prescription label. As we know, the medication is just a small part of managing a patient's disease process. Diet, exercise, lifestyle is, 80% of it. We partner with a couple different agencies in town that provide cooking classes and diabetes education, which we do diabetes education in-house as well.
So the reason why it's so difficult to get dental care in McLean County is because of the cost. The cost of a dental visit can run you anywhere for an exam and cleaning from $145 to $200. So dental is kind of like, for most people, it's not a necessity. It's not something that they need until they have a toothache. And in McLean County, there just isn't a lot of options for them except maybe going to the health department and then you pull a tooth and you're done. Think about if you didn't have money to go to the dentist and you lost your front tooth. What does that do for your self-esteem? Like, it's gonna affect how you get a job. It's gonna affect you emotionally. So here, like if we would pull your front teeth, we have access to partials and dentures here. We're giving them hope. We're giving them hope for a better job. We're giving hope, just to be a little bit happier because they can love themselves again.
The benefit of partnering with a community healthcare clinic from the healthcare provider perspective, specifically in a hospital setting, is that we're able to build a strong relationship with organizations that can meet our patients where they are. Making sure that care is provided in the appropriate setting, keeping folks out of the emergency department when that's probably not the best place for them to be provided and for the provider to provide that care makes a lot of sense. Specifically, the CATCH program that the healthcare clinic has engaged in has been a phenomenal win for the community, not just for healthcare providers, but the patients that we serve.
So with the CATCH program, we get referrals directly from hospital care management staff. The ones that have insurance, we connect to the correct facility. And then the other folks that are uninsured, we fold them into the clinic services just like we would with anybody else. The main goal of this program is to, capture those people that are not accessing primary care, but then also to keep them from going back to the hospital. Just last year, we had over 80% reduction in return trips to the ER after these folks have been contacted by the clinic. The clinic is a 501c3 nonprofit. We are 100% privately funded. We do not seek nor accept any state or federal dollars. We are heavily funded by McLean County. Over 80% of our funding is local, and then of course individuals is a very large portion of what we are funded on. McLean County is a very affluent county, and if we can't do it, then what county could really? And we're very, very proud that the county has supported us now for 27 years, and our individual giving has increased over that time, which is something we're also very proud of.